Great. So welcome, everybody. This is the National Care Coordination Academy. We are kicking off year 2. Very exciting. We have a great year planned for you guys. Exactly 1 year ago today, the Academy launched. So it's nice to come full circle and start off year 2 with all of you. So just some quick welcome and housekeeping reminders. This meeting is being recorded. Later on, we will upload this meeting to our Open Pediatrics platform. For those of you that are new, we'll make sure to get you set up on that. Your team breakout groups will not be recorded. If possible, please don't use speakerphone or put us on hold. Though some hold music can be very relaxing, can be a little challenging while we're in this large meeting. We ask that all participants be muted, and we will encourage your comments and questions to be put into the chat, and we will call upon you. Very, very important. We ask that you please rename yourself to include your state team name first. So for example, if you're from Colorado or Massachusetts, anywhere, you want to put the first abbreviation and then a little underscore, and then you can keep your full name. This will be very important for when we get to the team breakout groups. It helps put you into the right group. Our chat will be moderated. We encourage you to put questions and comments. Don't be shy. We want to all be together and make this, a big discussion. So please go ahead and put any thoughts or comments in there. You can also feel free to share resources in there. Any little bit is very helpful. And if you are using your phone and your computer, if you can go ahead and link them. So just wanted to show you how you can rename yourself. So if you find yourself under the participant list at the bottom of your screen, go ahead and find your name, select rename, and then put your state abbreviation, and then still keep your full name, and then you want to hit OK. Every session that we do for the Academy is eligible for continuing education credits. We are approved to offer RNs, NPs, MDs, PAs, and social workers credit. You must do the following to obtain your certificate. I'll ask that you put your information on the attendance Google Doc, which Erica will share in the chat. We'll share it a couple more times throughout the day, and then I will also email it out later today. For some of you, if any of your facilities restrict the use of Google Docs, it is totally okay. Just shoot me an email and say that you are requesting continuing education credits, and just be sure you're one of the approved professions. After you do the attendance Google Doc, later at the end of today's event, Erica will also share our evaluation, so please complete that. Once you've done both the attendance and the evaluation, your information will be sent to the Boston Children's CME department to request your certificate. You will then receive an email from the CME department. It can take about 2 to 3 weeks to receive that initial email. It will give you information for how to log into Boston Children's Cloud CME, where all the transcripts and certificates get uploaded. If you have any issues or questions about this process, or if you feel like it was 2 or 3 weeks go by and you're not receiving an email, definitely reach out to me. And just to let you all know, if any of your team members could not be present today, participants can request credits for watching the recordings on Open Pediatrics for up to 6 weeks after the live event. All right, so today's agenda, we're already at the beginning part of welcoming and open remarks. We'll jump in next to welcome some of our new teams. Then we're going to hand the floor off to Dr. Schiff, who will go over his session titled today, Sustaining Incremental Improvement. We'll take a 15-minute break. We'll come back and then we'll go to team breakout groups. Team leads, please be sure you have the breakout group instructions that I had emailed out a couple days ago. After that, we'll all come back together and spend the majority of the afternoon doing team report outs and a discussion. And then we'll close out the day and talk about some future sessions. So I just want to take a few minutes to welcome a couple new teams and also new team members of old teams. So we now have Team Kentucky joining us. We are so excited to have you guys. Such an excellent multidisciplinary team. We're really excited to work with you all. And then Team John Oshie Children's Hospital from Buffalo, New York. So excited to have you guys join. It's a great group of people. So I think it's going to be a really special year. I don't know if any of you wanted to unmute for a second and just say hi. Anyone from Team Kentucky?
I will say hello and thank you for the nice welcome. We appreciate it and we're very excited to be participating.
Thank you so much, Dr. Purcell. And do we have anyone from Buffalo on? I know this is a little bit of a last minute invite for Buffalo's team as we just onboarded them.
Hi, this is Vicki Landis. Thank you for welcoming us and allowing us to be a part of this group.
Thanks so much for making it, Vicki. We're so happy to have you guys. And then a special welcome to all the new team members. I know there are new positions that are on the teams, new family members have joined. So we're very excited to have you. And if there's any questions or anything that you have about the Academy, feel free to reach out to me. So I just wanted to show our updated map of all the different states that are all being represented here today. And we're all here together for the common goal of improving and sustaining care coordination and integration for children and youth with special healthcare needs and children with medical complexity across the country. I want to make note to all of our past teams, thank you for submitting your survey as part of today's session. Just want to let you know everyone is doing an excellent job. We are all at different parts in our project. And everyone is focusing on, different elements, and it's really showing how much improvement you all have made. We want to acknowledge that our Mother's Day card sessions that we have been doing for our new teams, that is a document where it outlines your team's project. It includes the data, what your ask is, what are you doing, who are your partners. We want to acknowledge that if there are teams out there that maybe are not completing that, but are still doing the elements of it, that's what that's all about. It's meant to be a tool to help you communicate. And so a lot of you are doing different elements of that in different versions, and that is totally fine. So thank you everyone for doing that and for all the improvement that you guys have had over the last year. We're really excited to see all your growth over the next 9 months. All right, Rich, I'm going to hand things off to you.
Thanks, Heather. And I also want to acknowledge the work of our core team, Erica Norkus, who's the coordinator of the Academy, and Heather Pamela, who, as you guys know, is sort of our master of ceremonies, or whatever the non-gender specific MC term is, but basically manages this with such incredible skill. So thank you to our BU partners and to our core faculty. Welcome to the new teams. We are beyond excited. The fact that our federal partners said, let's keep going. So as you all know, we are now into an additional year. I think I want to acknowledge Anna Marie Padlin, who is the project officer at MCHB, and our colleagues at the Maternal and Child Health Bureau of HRSA. Thank you for your confidence, for your vote of affirmation, and of course the support. We literally could not do this without you. So I wanted to do a quick review. Where have we come from? Being mindful that today's event, we have new teams, but the same dynamic that we started with a year ago applies now. The core faculty of the Academy very much wants to meet teams where they are. There is no presumption that you are, within a month of having financial sustainability in perpetuity. So it is a journey for all of us, because it's often focused at state level decision-making, think Medicaid, Title V, et cetera. We have to think not just broadly, but have to think at the level of states and territories, and how are we doing together? So welcome to the new teams. Welcome back to our teams from last year, and we're going to continue this journey. We want to continue to emphasize family engagement. I don't just mean perfunctory satisfaction surveys, but family engagement as critical partners to help with the prioritization and sustainability. What defines sustainability? Not just payment structures, but what does it advance? So I want to welcome our key partners that have representation in all the teams, and in particular our National Family Voices folks, Mary Jo Palladino, Kara Coleman, and my dear friend and colleague and mentor, Nora Wells. So thank you, Family Voices, for being critical to everything that we do. Measurement that matters, right? The M word. You have to be able to measure. We know this is hard. We also know that there continues to be a dearth of relevant measures for children with medical complexity, children and youth with special health care needs. But I can tell you many members of this academy have communication channels to decision makers at state and national levels. So measurement that matters, and we're going to advocate together. Equity in everything. How do we collect the right data elements to be able to stratify performance so that we can prioritize resources so that the outcomes, however we define them, functional outcomes, quality of life outcomes, can quantitatively demonstrate equity across populations, race, ethnicity, language, and disability status. So equity in everything that we do and everything that we promote. And seeking common ground and alignment of priorities. So families of children with medical complexity and children and youth with special health care needs keep telling us, hold us accountable to assess and to meet your needs, and in particular, to leverage your strengths. We have so much to learn, and families want an empowerment model, and we intend to deliver that in a measurable fashion. Our Title V colleagues at the state, territorial, and the national level. Common ground between the Title V programs and Medicaid and the Centers for Medicare and Medicaid services. What are some opportunities to look at a shared vision of success? And then providers across disciplines. This event is not specific to physicians nor to nurses, but includes providers broadly defined, developmental support, respite, community health workers, home visitors, social workers, behavioral health providers. So we hope that, especially for our new teams, you have a sense that this is a heterogeneous group of key stakeholders. And then finally, setting the foundation for the journey ahead. Heather correctly called out the fact that the Mother's Day card is not the outcome of the Academy. And I'm not going to steal Jeff Schiff's thunder, but you'll hear about that. That was one tool to advance the messaging for all of us to continue on the journey. And then finally, I'll close with this. I keep hearing from the teams almost in a self-effacing fashion, we're not quite as far ahead as, and I want to let you know that's okay. If you've made the commitment to be on the journey, we're not asking you to compete with the other states. The way Medicaid is designed, it's really difficult to think that you can move things forward in different states simultaneously. So it is a journey, and this the privilege of this Care Coordination Academy to be a resource, to be a connector, to be a bit of a provocateur of your thinking, to formulate approaches. This journey must continue, and we hope that each of you, by your re-upping to and your requests of the two new teams that we have for joining us, we're in it together, lots to prove. And with that, I'll transition to the next slide.
Thank you, Rich. All right, so I'm going to go ahead and introduce Jeff Schiff. We really appreciate all his knowledge. He keeps the Academy going. So Jeff, if you want to jump on and take it away.
Great. Hi, everybody. I want you to turn off your screen that shows me in 2021 and think of all the hair I had when I was the age of the picture. So Heather, thanks for finding this cartoon that is totally not me, but I can only hope. I want to start by riffing off of what Heather and Rich said, that we're turning the corner into year 2. This is the last, there's not a year 3 and 4 of this Care Coordination Academy. So I think our goal, as we've been sitting around as faculty and trying to figure out how to help, is to have us work with you to plan the future of your projects and to sustain it after this academy isn't around. And like any parent, our success is your success. So we want to make sure that we help you do that. Next slide. Because we're doing CME, I want to say that here's our objectives for the day. We want you to work on a plan to sustain your work, to identify target audience to communicate with about your work, to identify partners to expand your collaboration, and to take steps to broaden the work to increase its appeal to funders. So I think we'll do all of that. I want to say also that I have you can go to the next slide. We have a sub theme here, which is really around, I'll talk about a little bit later, which is really around taking care of yourself as you persevere. For those of you who are new, we borrowed the Mars rover as our mascot, and I was pretty fascinated by the coding on this parachute, which is the parachute that dropped the rover on Mars. And I think this applies to us. Far better is it to dare mighty things, to win glorious triumphs, even though checkered by failure, than to take rank with those poor spirits who neither enjoy much nor suffer much, because they live in the gray twilight that knows neither victory nor defeat. There you go, Teddy Roosevelt. And I think that we all know that the children we care for they want to dare mighty things, and they do that every day. So this is our first sort of theme or value. Next slide. Still taken from Mars is ingenuity. This is the little helicopter that's out there, and certainly something that all of the teams use is their own ingenuity and creativity. I was pretty fascinated that this thing can fly out there and that someone could design it and engineer it so well. And I think that the work we're doing requires a similar level of ingenuity and sophistication. They don't have an existing healthcare system to build their ingenuity on top of, which makes it a challenge. And then our last theme I really want to talk about, for those of you, to recenter everybody, if you go to the next slide, is this one that I think is really important. It's called radical incrementalism. And I think that really this is about meeting everybody where they're at and asking people to make the next actionable steps. And radical incrementalism is making radical, strategically mapped out micro shifts that don't completely disrupt the existing paradigm at once, but slowly and methodically over time. And another thing from a quote from Jennifer Gottsfeld, who is one of the authors of this term, said, talked about employing a tactic of radical incrementalism may get you much closer to a just and equitable world that you want to see. So I have a picture of an aircraft carrier here to point out that if we can turn everybody's aircraft carrier 1 or 2 degrees, we'll have a change the trajectory going forward. So that's our goal. Next, slide. We spent a lot of time in the last 2 sessions on what we called the Mother's Day card, because we launched it right around Mother's Day. And we wanted to talk about a model of communicating. And we're still going to, I think, take the content of that. But I think what we've heard from a lot of teams is that they don't have the time, or they don't want to spend the time working on specifically that kind of document. But I think that the same principles are really true. So today we're going to spend some time talking about communicating what people are doing, and then also doing the actionable work that has to be done. And I want to thank everybody who filled out the surveys. Our goal is to make sure that what we do is functional for everybody. And I think that that content is really important. I see somebody just commented that's a great book. It is a great book. I've read it to my kids. They remember it. And I'm sure some of you have read it to yours as well. I think the other thing that's interesting about this picture in the book, the fledgling falls out of the nest and the steam shovel puts the bird back in the nest. And I think that we want to make sure that everyone's, everyone is in their nest as they need to be, but when they're ready to fledge, they have the ability to fly. So I think it's really kind of an interesting thing and a nice metaphor as well. And in our Mother's Day card, one of the things we realized is that everybody here doesn't know quite who to ask sometimes. So we'll spend some time talking about that as well. Next slide. In the Mother's Day card, we really talked about these parts of a document. And the idea of the Mother's Day card for the folks who were new was that if you're going to communicate with people who don't know your work, there are some things that are really important to communicate and to understand. You need to understand who you're presenting to, whether or not it is colleagues who work down the hall from you, or your administrator, or your managed care organizations, or your legislature and governor. But you need to figure out who you're presenting to. You need to describe who you are and what you do. And the what you do is a really special part of this, because that's obviously what motivated everyone to be on this call today and to participate. We want to tell people a little bit about the data we have. We want to do a specific story if there's something that will hook people in. And then we want to talk about an ask. And today, I really want to talk about how we're communicating. And then I also want to talk about a little bit about the data. And then we're going to talk about what's an actionable ask. Next slide. To remind everybody that for sustainability, there are really three things that need to happen, and they are to have a care model that works, to have measurement that you can brag about or learn from, and to have adequate funding. And we've talked about those three legs of a sustainability stool, that you can't do one without doing the others. A lot of you have done incredible work around the care model. But I think and I'm former Medicaid medical director, so the work around funding is something that I've lived in, but also proud to say I'm a pediatrician who still works in the clinical setting and does some of the care model stuff. So I know how hard that work is. And I think we just have to think about how we as clinical leaders, or we who are in roles as parents or in roles as care coordinators, can really help make sure that all three of these legs are supported. So we want to go forward now and actually do a few surveys. We wanted to make this interactive. I've already been talking for a few minutes, and I want to make sure everybody gets to participate a little bit. So we're going to ask you two questions here about your communication, and then we're going to hopefully have people chime in on a discussion. So I'll just say before we do the questions that we like people to talk and not be shy. And if you want to start your conversation in the chat, we are looking at that as well. So our first question is really about who are you communicating with? And I want to add to this question as, well, I'll let you do the question and we'll talk more about it. So this is a survey. Heather, do you want to turn it on as a survey then? And then we'll ask people to do this. I will point out that what I'm really asking is for the team leads to fill this out right now. So if you're a team lead for your team, if you would spend a minute filling these out.
And it is select all that apply. So feel free to check off a couple, any that pertains to your team.
Right. And while your team leads are doing this, I'm going to talk a little bit about one other thing, and that's that do you have everybody, as you're communicating, are there people who you want to communicate with that you haven't yet, or people who you want to be on your team who aren't there? And I sometimes think it's interesting to think outside the box as well. Suzanne had we only want the team leads to do the survey, right? Thanks, Suzanne.
Right. All right. So I think we have everyone. I'm going to go ahead and end the poll and share the results. Any last minute entries? All right. I'm going to end it and share. Jeff, can you see my screen now with the results? Shared?
Absolutely.
Excellent. Look at the families. That's awesome. Okay, go ahead, Jeff.
Yeah. So this is great. So I'm happy families are highest on the list. I think that the other thing that we learned from the surveys is validated here is that there's a lot of communication with the internal providers or the internal administration, which I think we really have learned is a really key part here. And I can think back decades to start it to this and how important that was. Being a Medicaid person, it's nice to see the Medicaid managed care and MCOs and the Medicaid officials. And then I think we'll talk about some of these other partners as we get to, we're going to have do one more question. And I'd love to get input from all of you about how this communication is going. So if you could, I think Heather, the poll questions pop up directly on our own screen, so you can turn them off. And then the next one is really about what are you communicating? So we talked about the who, and now we'd like to talk about the what. And I think that and we'll dive more into some of the data that we're looking at and communicating in a bit. But I think that these are the things that I think people mostly communicate about. But this is also a select all that apply, and we'd love for the team leads to select these as well. I want to thank Heather for this technology and whoever built it, who was not on this call. It's kind of I think it's a good way to get people engaged, and I hope you do too. How are we doing, Heather? Do you want to close it out?
Yeah, I'm going to close out in 10 seconds. All right, I'm going to go ahead and end it, and then I'll share the results. All right, can you see it?
Yep.
Great.
Cool. So the first one is really who we're serving, and the second is the quality of the service. The third is uniqueness of the work. And then organization of the team and utilization by patients. So I think that it's nice to see this, because it's really nice to see people talking about who and the quality of what they do. So let's go ahead and go to the discussion. I hope you guys aren't too shy. It's, when you're leading one of these, that's always the hardest thing. But we wanted to talk a little bit about some of this communicating what's worked well and what has not worked well, so that everybody can share from each other's experiences right now. So anyone want to jump in? And I certainly welcome the new teams not to be bashful about this, but I'd also be happy to talk to some of our great veterans as well. But I'm curious about maybe if you just want to, if we want to start with how your team, with any of these questions. But I'm curious about, because we're doing this, and I wanted to say this in the intro, and we're doing this during a pandemic. So thoughts about how this communication works. How do you go to your administration and say, hey, we're in the middle of this and here's what we're doing? Has COVID changed the way you do the work, either the way you communicate or the way you actually do the work with folks?
And if anyone wants to put anything in the chat, that's fine as well. And then we can bring it up together. But anyone feel free to go ahead and unmute, and you can answer any of the questions, as Jeff said.
Well, for Team Kentucky, this is Pat Purcell, and I think it's a wonderful question because COVID changed the way that we communicate. Not that we wanted to change, but it was very difficult, as an example, for us to get in touch with our patients and their parents and what was the best mechanism to communicate with them. And so we utilized Sandra Gilbert, or F2F, because she had was able to offer some suggestions on ways to contact people. We met with our pediatric advisory committee as well as our parent and asked on ways. So we were able to communicate. In terms of communicating what we're doing as an office, I think, and I'm not a social media person, but social media has been one way that we've been able to communicate what we are doing in terms of Facebook, the services that we offer. An example is we have wonderful dietitians at the Office for Children with Special Healthcare Needs. And so we've utilized a little program, Let's Be Healthy, and we give recipes and we have little cooking demonstrations. And so that's probably, I don't know if that's the answer, Heather, that you all were looking for, if I answered that correctly, but we've really had to rethink how we communicate during COVID.
I'm curious from what you're saying. Thanks for the comment. I'm curious from what you're saying, whether or not, and Sandra, maybe you want to jump in as well, because I appreciate your comments on the chat, whether or not you think that the communication has improved in some ways, because I feel like even though we've changed from more episodic visits that might have been more in depth, we have more opportunity, and this is what we've heard from other folks, we have more opportunity to use telehealth for more frequent or deeper connections.
Yeah, I will chime in on that. I believe that most of the families that I work with have really appreciated the fact that I've took the time to reach out to them, even though we were having a pandemic and we were not working in our offices. So I think it has really helped with the communication between us and the parents.
Yeah.
You know that we really do care about what's going on with them, and we continue to show that by reaching out to them, even though we're not seeing them in person as much.
Thanks.
Jeff, I want to acknowledge too, from one of our spina bifida teams, Jason said that I think asking for the resources to get the data we need is even more difficult given institutional resources being dedicated to COVID. So made it more challenging.
Right. And I saw that, and Jason, I want to get to your comment after we do the next question, because I think it's really pretty crucial about how we get data. I want to, Sherry, I think what you said is really interesting. I don't know if you want to say anything verbally, but I think that that's one of the good things about Zoom is that you don't have to travel far for a meeting, and you can just turn on your computer and get the stakeholder group to grow. Do you want to say anything further about that?
Yeah, I was just going to add that works both ways for parents and professionals. Our family work group that we've been working with has grown and really became a great group. And I think it's because they have better access because of having the virtual option always. And even as we come out of the pandemic, whenever that is, I always want to be able to keep that virtual option to keep them engaged if possible.
Yeah.
I want to acknowledge too, Jeff, some of the comments about, some of the differences of going into sort of this Zoom and online setting, about some people missing the public and sort of missing body language, when you get that in-person session. So though there's been a lot of great things too, there are some things that can be challenging that we try to make up for in other ways.
Right. Does anybody feel like I have relationships with people who are in the teams here that I've never met in person? So I think that's one of the things that I think is really important. Anybody else? We've had a couple comments, I think, about how the parent and family involvement has gotten richer or more diverse because of this. And I think that's really a good thing. Anybody have any comments about communicating with sort of other stakeholders outside of your teams around what you're doing? Have you changed that at all during COVID, or has that communication gone well, or has that been a challenge, say with your administrators or with getting new team members from like a legal partnership or other things like that? I'm not hearing anybody. So maybe let's go back to this, the use of telehealth seems to have been effective. I think, have any of you been involved in discussions about sort of, hopefully we'll get there someday, the post-pandemic telehealth and what kind of world that would look, what that would look like for us? I guess.
In Kentucky, I'm sorry, we've discussed as an entity, and the success has been so great. I don't see that it's going to go away anytime soon, because it really offers us an opportunity to reach many rural areas of the state. So post-pandemic or not, yeah, I think it's pretty much here to stay for us.
Great.
And I agree, Dr. Purcell. I'm Donna and work at the Office for Children too in the Bowling Green area. And we actually started telehealth way before COVID even hit. We had been doing telehealth probably about 4 years with one of our neurologists. And it has helped so much. And especially since the pandemic, because now families are seeing the importance of being able to do Zoom and to do these virtual clinics. At first, they were very resistant before the pandemic, because I thought it was just because the physician didn't want to travel. They didn't see that with the 5-hour travel time, we were able to see more patients if we could continue to do telehealth at first. But since then, they have really seen the importance of it and now can see how we can do that visit and still be able to treat their child the way that they should be treated medically for their neurological needs. It really has helped with that.
Excellent. Someone else pointed out in here that we get to see what's going on in people's homes a little more directly, which I think is, I think I've heard that from other folks as well. And any other folks have, used that as, or I think that's that's successful, just to be able to understand a little more people's environments.
I think it's of utmost importance. If you don't understand what the hurdles are that these families are having to overcome at home and to even get to their appointments or what's going on at the home, then you have no idea of how to really help them. And when you see it, then it sort of opens your eyes and you can say, okay, I see what some of the hurdles are. And now we need to see what we can do in order to help that family.
Yeah. Do you have any stories you want to share about that? You don't have to, but I'm just curious.
I think one of the biggest eye openers, we see these families come in whose children are on portable vents, oxygen, and we just thought it was standard care for them to come into, the clinic room. But now when we can see their home environment and sometimes see what adaptive equipment they actually need, and then to see how small of a space they're working with, then we can take a step back and say, when we just give out this PT order that says we need a Hoyer lift, that may not be what they really need because there's no room for a Hoyer lift. It may be that they need an additional, something totally different type of equipment that we haven't even thought about. So it makes us think outside that box. And then when their connections aren't working and they're having to travel to McDonald's for the connection, then it's like, okay, now we see another hurdle that's happening. in which they can't even get connected. But with going back to those who have so many medical needs, we're able to now see we can do this neurological assessment right here, and they don't have to leave their home and then be exposed to so many other things that's out here.
I'll say that when I go into the clinic, I wonder about how much of what I'm doing is, you know, I actually need my stethoscope and them to be in person for sometimes. But I wanted to,
Can I just say something too? This is Sandra from Kentucky. As you know, as being a parent of children with special healthcare needs, we travel a great distance to see our providers. And it really does save us a lot of time and a lot of expenses. So, because we travel one way 4 hours, and then we see the providers, and then we travel back 4 hours. And, you know, it saves wear and tear on your vehicle. It saves money because you don't have to eat out. We end up leaving at like, you know, 5 o'clock in the morning, and you end up having to have breakfast, lunch, and, you know, usually we can get home to have dinner at the house. But then we also have animals at home. So we have to pay somebody to care for the animals. And if the kids were in school, which my children are not in school any longer, then, you know, we would have to worry about them missing so much school. And I mean, there were a lot of factors to look at. And so we chose to do some telehealth. And I think it's been wonderful for our family. I just wanted to share a little bit with you. Thank you.
thanks. I wanted to ask folks, especially the parents, maybe, if people are, because I think there's been a lot said here about what's worked well. I'm wondering about the frequency of visits.
I just want to acknowledge Adanique just raised her hand. So maybe once you
Okay.
finish your thought, Jeff, we can go to Adanique.
Great. Anybody have any comments about the frequency of visits? Are they more frequent, less? Are they more frequent check-ins and less in depth, or more in depth? Is there something that's worked well as far as that's concerned? I think that'll be a data point we'll talk about later, but Adney, if you want to chime in, this would be great.
Perfect. And good morning. I just wanted to say that the flexibility for virtual meetings has been great as a parent of a kiddo with special health care needs, but it also allows parents to say yes when they would say no. And I think that warrants, because we are running so much, it gives us the ability to say yes to more things than we would normally, if that makes any sense, because it frees up that commute and time in our schedule. You asked about the appointments and the frequency. For my household, I can honestly say that our appointments are probably less frequent because I really don't care for the quality of telehealth. But it depends on what it is, if that makes any sense. It depends on the type of the appointment.
Right.
When you have an appointment like with a PM&R, you kind of need to be there. You need that physical touch. But if you have something that has to do with maybe speech or another service that doesn't, like maybe a mental health service, you may not necessarily feel the need to be in person. So that can change. Our homeopathic appointments are okay virtual for the time being. I can see how eventually that will need to change, but I think it just depends on the family and what the needs of the individuals are at this period of time.
Great. Appreciate your comment about having more time. Hopefully that includes being here. So, there are a few more comments. I want to do a few of these, maybe a few comments about funding I saw here, which I thought were, Krista, if you want to talk up and tell us where you're from and your role, what's working with communicating via telehealth and the coverage of provider visits. Krista, are you there? And Nick had talked about home visiting programs. And I think one of my goals and one of the challenges that I think Medicaid is going to face is it's already come out some, is when and how and what to pay for on a continuing basis for home visits, whether it's the visits themselves or whether there's coordination that should be paid for as well, which has been a lot of what we've talked about here too.
Jeff, we have 3 hand raised now.
Oh, cool.
Trisha, did you want to go ahead and share your thoughts?
Yeah, I just wanted to add that the telehealth visits worked out really well for our family, and I heard this from other families as well, because we had established a really great relationship with our complex care provider. And so inviting her into our home to do a telehealth visit, it just kind of enhanced the care that we were already getting. So we saw her just as often as we normally do, but it was just one more added aspect to the care that we were getting that really felt comprehensive, I thought.
Got it. Cool. Thanks.
Then Jason was our next one. Jason, you want to go ahead?
Sure. I think you asked Krista about her comment, and I believe Krista is referencing that we have had, if our providers are not licensed in that state, we have been told we can't do telemedicine with them. So I think that had been suspended. That requirement is suspended, I think, for a while, but I think now it is either we're no longer getting reimbursed or whatever. So that has that creates challenges for kind of our schedulers of knowing which patients we can and cannot be scheduled for telehealth. So I think that's what Krista was referencing.
Yeah. I think Renee made a point too about getting licenses in other states or encouraging the providers to get licensed in other states. So I know that that's always a border issue or it was in Minnesota where you needed to get licensed to do this, but have providers made that effort to be licensed across the border so they could take care of folks?
We have, that's not necessarily a small thing when you have to keep up 3 different licenses and the costs and all of that. But we have, at least our physicians, I think our nurse practitioners have run into some particular licensing issues in some of our states. So they have not been able, I think, and to do that, or it's been too prohibitive, the process. But yeah, we have for many of us.
Got it. Heather, is there another hand up?
No, not at the moment.
Okay. I think this is I want to point out this is an interesting conversation because I think that what I'm reading in the chat and what I think we've heard from the leadership of the Academy also is this issue that there's some advantages around this communication. And then there's also the issue of the challenges of communicating in other areas. I saw somehow my chat just died on me, but I saw in here the people talking about communicating with the state services or with managed care organizations, et cetera. So since we're both talking about clinical care here and systems, one of the things I guess I would encourage you to talk about in your own sessions is how do you co-opt and bring the people from your who are involved in those payment mechanisms into the conversation with you and problem solve with them. So Heather, I think what I'm going to do is save some of these comments for maybe later or when we do the teams. And I think we ought to go now maybe to our next part here, if that's okay, and do the next question.
Yeah, that sounds
Jeff,
good.
this is Rich. I'd like to make an observation here. It'll carry over into that, but it's extremely relevant here. There's just recently a survey came out of the Health Informatics Organization, HIMSS, that basically surveyed delivery system leadership across the country. And essentially, delivery systems are talking about expanding their telehealth capability over the course of the next few years. And so I'm calling that out because remember, as the Care Coordination Academy team members, think about what's happening in the ecosystem that would facilitate, catalyze what we're trying to advance. There's a strong national push on the delivery system side to make this happen. So I think I would encourage us to think about both care delivery and the delivery of care coordination. And for those of you that have been with us long enough, you know that there is a distinction. That's really important. And then another theme I want to call out that both Jason mentioned and also Annie and Megan from CHOC called out is sort of the diversion of resources into COVID response. But I think I like Annie, how you, Annie Carpinelli from CHOC, that you guys found a workaround. So in sum, as we move on to the next discussion point, I think the COVID challenges offer the opportunity to find the value add, many of the conditions that you discussed. Systems that are not just pediatric are looking to expand. That gives us a horse that we can hitch this cart with and be thinking about emphasizing disparities with telehealth. So telehealth enhances geographic access, et cetera, et cetera. So be thinking about these rubrics for promoting the idea going forward. So thanks for letting me jump in, Jeff.
Thank you. All righty. Here we go. So we wanted to use a little bit of time talking about data around this, and I'm going to link this also back to what we just said. And I think those of us who are been in medicine for a long time think that you need a randomized control trial with, 1,000 participants in each arm to have data you can talk to folks about. And I've been trying to dissuade folks from that theory of data a little bit, because I think in terms of policy folks, they appreciate some of the stories like the story we heard earlier, and also a little bit of data so people understand what's going on out there in the clinical world or in the world of families. So I wanted to, in terms of supporting what we know needs to occur to coordinate care for our children and families, I wanted to ask about what data you use to support your work now. And this is our survey. So this is also a check all that apply. The first two things here about children served and patient complexity talks about who's involved. The data about services and what's provided is about what you do. And then the next three are really something about outcomes, like how do you talk about either family experience, utilization, or clinical outcomes, and then also whether you use national data. And I'm curious, because I think it's really important that we use the data we have, or start collecting some data to influence the conversation as far as sustainability. So with that in mind, I'm going to ask folks, again, the team leads to sign on here. I think we need that music from like a game show.
We should totally build that in. I'm sure there's a Zoom feature that has that.
Alrighty.
I'll find
Okay.
it if there is one.
Okay, here you go.
Give everyone a few more minutes. This one takes a little bit longer with the select all that apply. So I'm seeing everyone come through.
Great.
I think we have one more team left to respond. Awesome. Okay, I'm going to go ahead and end the poll and share the results. All right.
Great. Excellent. Well, I guess the first thing I want to say is it's really cool to see the high percentages across the board, you know, especially about the children who are served. I think the data abound. It's also cool for me to, as I look at this, to see the data about services provided through the CCMT or through other tools, because I think it's really important that folks understand that. And then both the patient experience and utilization is really important. So I think I'm very glad to see that folks are creating and using their local data, because I think that's the story that needs to be told. I want to go, we can go to the next slide, Heather. Rich, do you have any thoughts as you saw the data slide that you want to comment on? And then I'm curious about folks' experience about how you use and communicate the data in your own, either in your own teams or to your administrators or other people in your state.
Yeah, I think, I don't know that I'd add anything, Jeff. I was really pleased to see the number of folks that are measuring the data. So let's open it up to the state teams, and then I'll reserve comments and reflections based on what folks are saying. But it's wonderful that it isn't just pay us because we're special, but in fact, here's what it looks like. Here's what we need to sustain. So congratulations to the team. That's to the team. So that's great. Why don't we go ahead and open it up, Jeff?
Great. So I'm going to ask a discussion question that's you can answer the ones that are on the screen, but I'm also really curious about if anybody wants to talk about, give us a story about their data, about how they communicated it or who they communicated it to, and whether it was effective or not, or whether they had any advice to any of the other teams about how they communicated their data. Feel free to raise your hand, although I am computer challenged right now. I can't see the hands, so.
I'm watching for the hands.
Yeah.
Okay. Dr. Purcell, do you want to go ahead and check?
I don't know if Ivy Alexander's on the call or not. She's the executive. I mean, she is. So
yes, I am
sharing this. There you are, Ivy. Ivy, do you want to talk about our AMCHIP poster? Because we use the data for that.
Sure, I can talk about the AMCHIP poster. So as we've talked about the telehealth information earlier, staff indicated that we've been doing telehealth for years, but with COVID, we basically expanded what we were offering through telehealth. And so the data that we collected there, of course, the patient visits plus the surveys to parents, because we reached out following each visit. We prepared parents for the visit, prepared the providers, and reached out to both the parents and the providers with survey data. So we presented that data to the folks that attended the AMCHIP conference this past year. So that's just a small piece of data that we had that we were able to share with someone.
Ivy, did you use that data? That's the National AMCHIP conference you're talking about?
Mm-hmm.
Have you used the data locally?
We have only used it just for our own internal information. We're part of the Cabinet for Health and Family Services. The data was shared with the cabinet itself.
Right.
Yeah,
Great.
and then, yeah, we just use it internally, really, to enhance our services.
I think
We've
Suggestions.
also, internally too, is sharing it with our providers. We were able to do that. So all our providers have an idea. I think as they are seeing the patients, they don't realize the number of telehealth visits that are actually occurring at the office. And then as a follow-up on the AMCHA poster, I've had two individuals from across the state that have reached out to me to talk about our program and how we did our telehealth, and they asked questions about it and whatnot. So I've met with a couple different people that just reached out from watching the little video that accompanied it.
great. I think building the network by talking about what you do is something that if you're a shy person, that's a hard thing to do. But if you're not, then it's, if you're willing to do it somehow, it really helps people to get connected. Anybody else want to talk about their data or using or communicating their data? Either in their own system. I'm thinking about the Florida folks or the Chalk folks who I know have had lots of conversations with their administrators about this.
I can go. This is Annie. I'm sorry if it's loud. My neighbors are doing construction. That's one thing that we're kind of struggling with, and we were going to talk about more in our breakout group, actually, is because we're kind of in this period of analyzing our data, and we feel like we're telling people, we're excited about this, and these are preliminary things, but we don't have firm conclusions to give them. And I think the people who completed the care coordination measurement tool are anxious to learn what we learned from that. And so we're trying to figure out, instead of just, giving them lip service, so we wanted to give them valid information, and we want to continue to support how eager they are about the integration that we're working toward. But that has been a bit of a struggle, to be honest.
A struggle because you're still analyzing it, or just, is that what you're saying?
Yeah, we got such a great response that, we're working with the statistician and trying to figure things out. But, there's that holding period when you don't really have firm data. We're trying to figure out how best to communicate that without just saying like, we're still waiting, Yeah.
I think I won't tell you how to get through the holding period, but one thing I think is really helpful is once you're through the holding period is to have a big, broad ability. Maybe you can do it on Zoom now for people to really understand and hear about the data together. We've found that really catalyzes people's interest because everybody is curious and everybody's a scientist when you present them with the data together. And it's not just for the academic folks, but it's, coordinators, front desk staff, everybody really builds off of those kind of things. Thanks.
Jeff, this is Jessica. It looks like we actually have another hand raised. Ivy Goldstein has her hand raised. Do you want to go ahead, Ivy?
Sure. I am not the data person on our team. We were one of the participating states in the CoIIN, and there's a ton of data that we're collecting and using, but one that was particularly effective that I think may have been shared here a while back. The clinic calculated the touch points for one particular child over a 2-year period and created a graph. There were like hundreds of touch points. It could have been filling out a document, talking with a parent, having a visit, a multitude of moving parts. And when that data was presented to our state Medicaid folks, that was actually transformative. And their commitment grew. They were already involved and engaged, but that cemented it.
That's a great story. And I think it's, Ivy, I really appreciate you chiming in, because I think what you're really saying is that this is a moment where you get other people engaged by telling them a story that involved a little bit of data collection, and I think that that's, everybody on this call knows at a gut level what you're talking about as far as how complicated this work is for families. But when you start putting a number on it or talking about how many times or how many phone calls and those kind of things, I think it means something different.
It was powerful.
Jessica or Heather, any other comments on this that you want to bring up?
I don't see any more hands raised.
Alrighty. Let's go ahead. We have a few more minutes and I want to get to two more things if possible. So I'm going to ask Heather to advance the slides. While she's doing that, Heather, are you there? While she's doing that, I wanted to just talk, the last part we wanted to talk about in terms of,
Sorry, Heather and I are texting. There's a little bit of a technical difficulty, but we'll be with you. Keep going, Jeff, and we'll get them up.
Okay, awesome. Okay, so I'll tell you what's on the slide before you see it. The last question I wanted to ask was really about something that was something we were trying to get at with the Mother's Day card. And that's, do you have a written description of I think about spread. I would like all of your programs to be hugely successful, to spread across your whole state or region of the world. And then and I think about how important sometimes the conversations you have are, but also how important it is sometimes having something written down, which was kind of the idea of the Mother's Day card. So I wanted to ask whether or not you have an actionable ask on paper, whether or not whether we have a written description with an actionable ask. Whether or not you have a written description of your program, but it doesn't have it, you're not asking anything. And then whether or not people don't have a written description. And I think that, I guess I think about this because, in terms of perseverance, I think about the idea that we want to get people engaged. And we want to get them to continue to be engaged with us. And like Ivy's story just now about Medicaid getting engaged after they heard a story, it's sort of like you want to be able to say to folks, what's the next thing you can do to make this happen and work here? It's not about saying at the end of the day, we have big goals and we all know what those are, but it's about what's the next thing we can do to engage folks and to have them kind of co-opted into our team. So, are we able to do the survey here or not? I'm not seeing anybody. So I'll just go ahead and we'll just open this up and ask people if they had if people have had success going to an administrator or a payer about something actionable that they had folks participate in. And I think about this as expanding your team and co-opting other folks to be engaged. So anyone have a story there that they could share with the group? Nope. I think we're going back to our technical stuff. We are on slide 22. We're on slide 22.
Jessica. Okay, 22. Okay. Great. Thank you. Perfect. Got it.
Can you do the survey, Jessica, or are we out of survey capability?
I'm going to see if I can.
Okay. See, if you're in a room with all of us, we'd have one of those funny clicker things going. And so that would be the technology we'd be struggling with. This is just a different one.
I don't think I'm actually allowed to launch the polls because I'm not a host, but I can share the screen.
Okay, so why don't you just go to the next slide then? It's 23.
You got it.
Okay.
Oh, sorry.
Yep.
Tell me when to stop, Jeff.
You are got after question 4 and that stop. Okay. So I want to know if people, let me just start by asking, do people have, how have asks gone for folks? And I'm looking at Michigan, and Teresa has, they have a written description to share with administration. Now we're working on an impact assessment to identify the scope of the work. Teresa, is that well received? If you're on mute or if you want to talk, that would be great.
I think it's being well received. I haven't been part of the higher leadership meetings, but we do have the ability to move forward. And so we are exploring what that's going to entail and what does it mean across our Medicaid different divisions and departments, what their involvement will be, what will be the necessary steps to be able to complete. We're looking at a health home model. So that's exactly what we're doing is we've identifying some steps, identifying who needs to be involved in that process, what it would entail, so that we can understand really what kind of a heavy lift this is going to be. Is that helpful?
No, that is helpful. I think, I guess what I would say is, I think what you're bringing up is this, I don't want to say I think it's a challenge for clinicians to connect and figure out how to help the administrators, or even in your local site or in Medicaid, sort of take those next steps. Can I ask just one more follow-up question of you? Do you have a plan, or as I sometimes would say, and I've heard other people say, is a plan to have a plan, with the administrators, that they know what the next steps they need to do, and what your role is, and the steps are identified?
What we have been asked to do is to put together what they call a RACI document. That stands for responsible, accountable, consulted, and informed action plan, by which we need to identify all the stakeholders across the top. It's really just another kind of a Gantt chart, along with all the steps along the row columns, and then you just try to figure out exactly who needs to be involved in which step and at what level.
If I can jump in here, this is Steve. Because I've been working with Teresa.
You have two mics open, I think. So I don't know if you want to close one.
Ooh. Hope not. Did that help?
Say something else.
The Michigan project?
No, it didn't help. Sorry.
Well, then I'll just stand down.
I don't want to.
Steve, just try clicking the mute button. If there is a secondary microphone that you're not aware of, that might do it. No. But generally, whatever you have to say is important. Speak slowly, and we'll do our best to suss out what you're trying to say, especially because we know you're working closely with Michigan. So I had a follow-up question for Teresa, but please, you should jump in.
Okay. What's different about Michigan is that the Children and Youth with Special Healthcare Needs program is working on this proposal. It started with a clinic or a program at the University of Michigan Health System. But the proposal, that was the catalyst for a proposal to build a system of care for all medically complex children in Michigan. And so it is an encompassing proposal, and Jeff and I have actually discussed it.
So I'll just add to what Steve had to say just a little bit to
Jeff,
say-
I have a little bit of a technical urgency. I just got text from Heather Pamela, whose computer is going haywire. If all of a sudden the meeting shuts down, give it about 2 minutes and then use the very same link that you entered in. If nothing happens, we're good. And Heather's trying to do some backdoor engineering. But if we lose you, it's the same link that was in the invitation. All right, Jeff, go ahead.
No, I was just going to add what Steve had to say is, I think the difference, or not the difference, but Michigan is now working on this through at the state agency level, and that is just that's wonderful. And they have all the complications of having to figure that out. I think that I don't want people to be intimidated by that, by getting to that step. I do think, though, that I guess what I'd say is, I think there's two parts of it. One is selling what you do, which shouldn't be hard because everyone's doing such wonderful things. And then the second part of that is actually getting from selling it to having them figure out, like you said, this RACI document or these next